interested in one of my favorite subjects, which is medical laboratory technology. Today's open house, we're going to cover what an MLT is, what does an MLT do, the job opportunities and pay for a medical laboratory technician, who is this program good for? Then we're going to talk about Lakeland's program, the costs. That is probably pretty important for you guys, and other different options that may be available to you. We'll talk about how to apply to the program, other sources in which you can look into to find out more about it, and then we will open it up in the end to questions. So again, my name is Kathy Davies. I am the Medical Laboratory Technician and Phlebotomy Program Director at Lakeland. I've been here for a long time. I think full-time for about 27 years. I am indeed a Lakeland graduate. And it's really neat to think that I actually graduated from this MLT program that I am now directing. So what is an MLT and what does an MLT do? An MLT does lab work. Okay, we are the science behind the medicine. We celebrate the science as we save lives. An MLT is a laboratory professional who performs laboratory testing on blood, urine, feces, spinal fluid, and any other body fluids that whatever they send us, we're going to be testing. MLTs and laboratory professionals provide 70 to 80% of the objective data used to make clinical decisions. In other words, 75% of decisions made by physicians on how they're going to treat their patient is based upon information that the laboratory provides. There are another number of different departments within the laboratory that you could either specialize in, or you could be a generalist and work in all of these departments. The chemistry lab is one of them. The hematology lab is another. In hematology, we will look at cells and count cells, maybe decide what kind of leukemia does the patient have, if indeed they do have a leukemia or an anemia. In the coagulation lab, we might, when the doctor takes you to surgery, he certainly wants to make sure that you're going to stop bleeding when they cut you open. So we'll do testing to make sure that that happens. We're also, for people who are on blood thinners, we will make sure that those blood thinners are doing their jobs. Urinalysis lab, what your body throws away via the urine tells a lot about what's going on in that body. And in this department, you will be doing those type of tests. You'll also look under the microscope to see different things that are in urine that can either be normal or abnormal and help the physician treat you. Let me just make sure I didn't miss. Yes, I did. Okay. So the next department we'll talk about, this is blood bank. We want to make sure that the blood that we're going to give you is going to help you and not hurt you. And this is where they will mix your blood with the blood donor's blood and make sure it's going to be okay for you. Clinical microbiology lab. Do you have an infection? If you do, what's its name? If you look at all of these real fun, different colored tubes, those are the biochemical reactions that the bacteria are making in those tubes. And based upon those reactions, we can give that organism a name. Maybe it's E. coli, maybe it's Pseudomonas. Then we can mix it with different biochemicals or different antibiotics so we can tell the doctor what would be the best antibiotic to treat the patient with. Keep going back. Okay, so jobs as an MLT. You can work in hospital labs. You can work in reference labs. In hospital labs, they tend to pay a little bit more. They tend to be a little bit more fast-paced because they are helping patients who are in the emergency room and patients that are maybe in intensive care or so on. So those people we need to have those results to the physician faster. You can work as a generalist. which would mean you might rotate through all different departments in the laboratory, or you could work as a specialist and just specialize in one of those departments that I just mentioned. Job opportunities are humongous. Graduates and second-year students are in very high demand. I continually get emails and phone calls from area hospitals asking if I have any students who might need a job. The area hospitals are indeed offering lots of sign-on bonuses in addition to wanting everybody. So the job opportunities and how much you would get paid at Lakeland, we offer an MLT degree, which is an Associate in Applied Science degree. So according to salary.com and Lakeland graduate data that I have obtained, students are making about $42,000 to $62,000 to start. That's just a start, and it'll just go up from there. So again, pay increases as education is earned will happen if you earn your bachelor's degree, if you get a discipline-specific ASCP certification, if you get your bachelor's degree and MLS, that even pays more, okay? So pay increases with promotion. You can become a team manager. You can become a lab manager. The sky's pretty much the limit for laboratory technicians. Is a career in MLT right for you? Do you see yourself in a career that offers diverse opportunities? Remember, you can work in any of these laboratories or all of the different laboratory departments. You are able as an MLT to work full-time, part-time, PRN, which is as needed. Jobs include day, evening, and night shifts. Would you like to work in healthcare, but not directly with patients? We don't see patients very often unless we're also drawing blood, and most laboratory workers do not draw blood, but we get to celebrate the science behind the scenes and help people from behind the scenes. We have an aptitude for science, love solving mysteries, and working with our hands and our brain. Yes, as a medical laboratory technician, you are allowed to use your brain. So we do have to teach you to think critically and make wise decisions. If you enjoy a fast-paced work environment, the laboratory is for you. So what about Lakeland's program? I like to think of it as two halves. The first half are the non-MLT courses, all the supportive courses, and then the other half are the MLT specific courses. They'll be mixed up along in one semester, you'll take some MLT classes with the supportive classes with them. So you will be taking courses in biology, anatomy and physiology, microbiology. You'll be taking classes in chemistry, elementary chem, intro to organic. You'll take courses in English, communications, and math. The MLT specific classes are organized exactly the way the laboratory is. For the hematology lab, we have a hematology course. For the chemistry, a clinical chemistry course. Clinical microbiology, blood banking, and immunology. There's even a urinalysis course. For Lakeland's program, pre-admission tests are not required because we have no minimum score. We feel that if you make it through your anatomy and physiology, you're definitely ready to get into the laboratory courses. So when are Lakeland's classes offered? They are offered during the day, and because of this COVID-19, they're becoming more hybrid, which is exciting. Lakeland's program is an accredited program. We are accredited by NACLS. Our last visit from NACLS gave us a perfect score or a perfect visit. That doesn't happen very often, but we are proud of that. So we have a good program, and it is proven by our accreditation status. The program includes 512 hours of clinical rotation in an area hospital laboratory. Lakeland finds you this clinical rotation, and you will go to the hospital and rotate through each department in the laboratory and learn and experience firsthand what it's all about. Graduates from Lakeland are eligible to take the MLT ASCP certification exam. I'm very proud to say that 100% of our MLT graduates for the past 4 years have passed that certification exam, and 100% of those students are employed. Remember, we did talk about those sign-on bonuses, and they are common. What are the costs of the program? The tuition in county is up there, and then if you live out of county, that's a little bit more. Don't forget that you're going to have to be paying for books. There's a background check and drug screen that's required, application fees, supplies and uniforms. Usually that's because when you go to your clinicals, they're going to want you to purchase scrubs. There will be pre-screen testing, health testing. You have to have a physical and some immunizations. The certification exam is about $200, and then the graduation fee. Now remember, all of these costs are estimates and can change. If you need financial help, don't hesitate to contact our financial aid department. There are scholarships available. There's one specifically for MLT students, which is the Etta Roeder Memorial Scholarship Fund. There are also, and I just heard about this, that Lake Health is offering huge scholarships for students in Lakeland's MLT program. There are a number of different options that you can complete this program. Most people complete it during our using our traditional option, which is a 2-year associate degree program. Most people, even though you can do it in 2 years, most people complete the non-MLT classes and then start the MLT specific classes and then complete those in 2 years, which then makes it a 3-year program. You can do it in 2 years because we have had people do it that way. There is also a fast track option for students who already have a bachelor's degree. There are other options for bachelor's degree people who are already working in an area hospital. Come see me because I have a great way for you to become certified. So how do you apply? You can go to lakelandcc.edu. I encourage you, you need to apply to the college, which is what that website will take you to, but you also, once you finish anatomy and physiology and med term, you're going to be eligible to apply to get into the MLT program. So that's another application. I want you to come talk with me, please, because I can help you with making a plan for you so that you can know where you are and know where you want to go and know exactly how to get there. And I think if students really can see the end of the tunnel and know that they have a plan, your chance of reaching that goal are much higher. I'm pretty friendly. Come and visit me. Give me a call. Give me an email. We can talk. So if you need more information after today's session, you can call me, or you can go to www.ascp.org or ascls.org. Those are 2 laboratory societies that can help you out with lots of information. So, does anybody have any questions? If you have any questions, Jessica, say that again because I didn't quite get that you posted up there. I didn't read it fast enough. What do most students ask me when they go into medical laboratory? They usually ask me, where are the clinical sites? Where do you go once you finish the program, the very last semester, you'll be placed into a clinical site. Those are in hospital laboratories. We have affiliation agreements with the Cleveland Clinic. So Cleveland Clinic Hospital's main campus and some of the smaller ancillary hospitals are part of are places where we will place students. We also have affiliation agreements with university hospitals. So university main campus, Ahuja, our students are going to, Geauga Hospital, Geneva, and then we also have an affiliation agreement with Lake Health. So people are going to Lake West, not to East, because they don't do all of the lab work, but mostly Lake West. Is there anybody else who has any questions? What do most people love about laboratory? You know what? I'll tell you what I love about it, and I think most people love about that also is when you go into work, you get to share the knowledge that you know and your love of science with your fellow laboratorians as you perform the work. You don't have to worry about, shh, don't talk, because there's sick patients around and you can't giggle because somebody might be sick and it's just not professional to do that around them. But we're in the lab, so we can I remember one day when I was looking under the microscope and I just saw these perfect cells that were so exciting for me to see. I never saw them so perfect. I'm calling my friends all over, look at this, and what does this mean? And then we thought, well, yeah, it meant that this patient probably had leukemia. And we were, making slides for the Lakeland students and doing all these things. And then we found out, oh, this is on a 4-year-old. So we did get sad and we knew we had to call the doctor. But in my heart, and one thing that I do love is that I was able to help that 4-year-old. We were able to diagnose that 4-year-old so that 4-year-old could get on the road to recovery. But as a lab technician, we could kind of distance ourselves a little bit from the pain and the suffering in which that family is going to go under from that. Another thing about lab that I like is I love to solve the mystery of what's wrong with this patient. You know what the doctor's ordering, so you kind of have an idea of where that doctor's looking. And then when you look at the test results, you can then use those results to determine what the patient has or what the patient doesn't have. Caitlin, I'm currently attending Lakeland. I need that again, Caitlin. Can you send that again? I missed it. I'm sorry. If you're at Lakeland now, the classes, and I didn't see your whole question, Caitlin, but 2 classes that you want to watch, I was going for radiology, you have the radiology completed. We have taken a few students from radiology. Tina and Jack, and radiology is indeed an excellent program. And we've traded students back and forth. We're all pretty nice. I think what you're taking anatomy and physiology. I think you take chemistry. I'm not sure, but the prerequisite courses are almost the same. And I think that that you'll love lab. Most people do like lab. You're again, radiology, you're going to be with the patients a lot more than if you're in the clinical lab. So you need to, weigh that option out. And what your decision is, but I'm more than happy to talk with you about that. Is there anything else? Anybody else want to ask questions? I wish I could hear you guys. I just love talking to people and seeing them. And I'm a slow reader. What are new students surprised to learn about the field? They're surprised to learn that we're so smart, I think. I think that, and that there's so many fun things to learn. Really, that's what they're surprised about. I think it's because traditionally people don't know what the laboratory does. People, they give their blood, they know what the phlebotomist does, and then they get results. They don't know that there are educated, knowledgeable people who actually perform those lab tests. And so people that do go into the field are like, wow, we learn a lot. Wow, we know a lot. And you're absolutely right. We know a lot, we learn a lot. And I think the more that you know, the more exciting your job gets, because you're not just pushing buttons, you're looking and evaluating those results and knowing that you're helping somebody. Kelly, do you have a question?
Mm-mm.
No? Oh, no. Okay. It's good to see you. Anybody else have a question? I'm more than happy to answer anything. And please, if you're interested, just send me an email. I can talk to you privately. And I wasn't paying attention to that last question that just flashed up on the screen. Can you send that again? What are some other things that students ask me? They're surprised that we have phlebotomy as part of the MLT program. There's a 5-week phlebotomy course, and phlebotomy is just a teeny tiny bit of what laboratorians need to know. We need to know about phlebotomy and be semi-okay with drawing. Most of us never draw again, but if we're going to get a specimen from a phlebotomist, it's really good to know how the phlebotomist got it, whether they drew the right tubes, whether the specimen was handled properly. So that's another thing that people are surprised that we actually do. Anything else? No? Okay, again, I want to say, please, if you have any questions, email me, call me, get a hold of me. I love talking to my potential medical laboratory technology students. Thank you so much for attending the program. Thanks. Bye.